Welcome to Part 4 of Emergency Management. During this section, we will discuss legal and ethical considerations in jail emergency response. Correctional facilities face unique legal and ethical obligations during emergencies, particularly natural disasters and pandemics. The law does not pause during crises. Constitutional rights remain intact, and failure to uphold them can result in lawsuits, civil rights violations, and even criminal liability. Jail staff must understand their legal duties, ethical responsibilities, and the limits of authority when managing emergencies. Constitutional rights during disasters, for example, Eighth Amendment. Key principle: even during emergencies, inmates retain constitutional protections, particularly under the 8th and 14th Amendments. Eighth Amendment: cruel and unusual punishment. The U.S. Supreme Court has ruled that deliberate indifference to the health and safety of inmates may violate the Eighth Amendment. Farmer v. Brennan, 1994. Jail administrators must not knowingly disregard serious risks to inmate safety during emergencies like flooding, fire, or disease outbreaks. Examples: leaving inmates locked in cells during flooding without food, water, or ventilation, as in Orleans Parish Prison, Hurricane Katrina. Ignoring known fire risks or delaying evacuation during a facility fire. Failing to provide protective measures or medical attention during a pandemic. Legal implication: if a court finds deliberate indifference or failure to act reasonably, the agency and individuals may face lawsuits under 42 U.S.C. 1983. Duty of care and liability. Definition: the duty of care is the legal obligation to act in a manner that a reasonable professional would under similar circumstances. In jails, this applies to both staff and administrators. Scope of duty: providing basic needs, food, water, shelter, hygiene, protecting inmates from known hazards, ensuring timely medical care, maintaining secure and humane housing during emergencies. Liability exposure. Failure to plan for foreseeable disasters may constitute negligence or even gross negligence. Staff who violate policy or act recklessly under stress may face personal liability, especially in cases of use of force or denial of medical care. Agencies may also face institutional liability for systemic failures or lack of training. Ethical consideration. Correctional staff have a moral obligation to protect those in custody. People who cannot protect themselves or leave unsafe conditions. Emergencies often require rapid movement or restraint of inmates, raising concerns about the reasonable use of force in high-stress scenarios. Legal standard: under Kingsley v. Hendrickson, 2015, the use of force must be objectively reasonable in light of the facts and circumstances. Excessive force violates the 14th Amendment for pretrial detainees, or 8th Amendment for sentenced inmates. Risk factors: using force to silence complaints during prolonged lockdowns, over-reliance on chemical agents or restraints during evacuations, aggressive handling of medically vulnerable or mentally ill inmates. Best practices: use only the minimum force necessary to maintain safety and control. Document every use of force incident, especially during chaotic conditions. Provide training for officers on emergency force decision-making and de-escalation under duress. Let's move on to the next topic. Emergency Operations Plan, EOP, Emergency Action Plan, EAP. An Emergency Operations Plan, EOP, or Emergency Action Plan, EAP, is the foundation of a jail's readiness for natural disasters and other emergencies. It is a structured, facility-specific document that outlines how staff will respond, coordinate, and recover from incidents while ensuring security, safety, and continuity of operations. Medical isolation and quarantine procedures for pandemics. During public health emergencies, such as pandemics, correctional facilities must balance infection control with constitutional protections and ethical treatment. Legal guidelines: inmates have a right to adequate medical care under the Eighth Amendment. Isolation and quarantine must be medically justified, time-limited, non-punitive, conducted under due process when prolonged or restrictive. Common violations: using segregation cells or punitive solitary for medical quarantine without appropriate care or review. Failing to separate symptomatic inmates from healthy populations. Not providing hygiene supplies or cleaning infected units. Ethical considerations. Quarantined inmates should retain access to mental health care, legal resources, and communication with family. Decisions must be made with transparency, compassion, and consistency. Best practices. Follow CDC guidelines for correctional settings during infectious outbreaks. Keep clear medical records and offer periodic reevaluation of isolation needs. Train all staff on infectious disease protocol and PPE use. Emergencies do not suspend the Constitution or relieve jail staff of their obligations. On the contrary, high-stress environments test the professionalism and integrity of correctional institutions. By understanding the legal boundaries and acting ethically, jail staff can safeguard lives while protecting themselves and their agencies from serious liability. Communication and decision-making. Effective communication and timely decision-making are essential during emergencies in a correctional setting. When natural disasters or other crises strike, the ability of jail staff to clearly relay information, coordinate resources, and make fast yet lawful decisions can mean the difference between controlled operations and catastrophic failure. This section outlines three core components. A. Incident Command System, ICS, Basics, B. Internal and external communication, C. Decision-making under stress. Incident Command System, ICS, Basics. The Incident Command System, ICS, is a standardized, flexible framework used across the U.S. for managing emergencies. Jails must be able to seamlessly integrate into this system during county or citywide disaster responses. Structure and terminology. ICS divides emergency response roles into clearly defined functions. Incident Commander, IC, the person in charge, typically the shift supervisor or jail administrator in early stages. Operations Section Chief, manages tactical operations such as evacuation, security, medical. Planning Section Chief, collects and evaluates information, creates incident action plans. Logistics Section Chief, manages resources, for example, food, water, equipment. Finance Admin, Chief, tracks expenses, overtime, reimbursements. Common ICS terms. Span of control, refers to the optimal number of people, 3-7, one supervisor can manage effectively. Unity of command, each person reports to only one supervisor. Incident Action Plan, IAP, a written or verbal plan outlining operational goals for the shift or operational period. Jail's role in county-city response. The jail may be a critical infrastructure site or an evacuation destination. Jail leaders must communicate with County Emergency Operations Center, EOC, Emergency Management Agency, EMA, Sheriff's Office Command, Health and Human Services or Public Health Authorities. Jails should designate liaison officers trained in ICS and authorized to speak for the facility during joint operations. Internal and external communication. Communication during an emergency must be clear, redundant, and documented. In correctional facilities, communication flows in two directions: internally, staff and housing units, and externally, agencies, courts, media, families. 1. Dispatch and radio protocols. Use plain language over codes during emergencies to ensure clarity. Test handheld radios, backup batteries, and communication towers regularly. Ensure dispatch knows your facility layout and unit names. All staff must know radio call signs, emergency codes, and chain of communication. 2. Media and family inquiries. Designate a public information officer, PIO, or assign communication duties to one command staff member. Do not release confidential information about inmates or staff status without authorization. Use scripted messages and official platforms, website, local media, hotline for updates. Prepare answers for questions such as, is my loved one safe? Has the jail been evacuated? Are inmates receiving food and medicine? 3. Coordination with courts, DOC, law enforcement. Inform courts of transport delays, missed appearances, or relocations. Notify the Department of Corrections, DOC, of long-term evacuees or parolees in custody. Work with other local law enforcement for joint evacuation, transport, security, crowd control at staging sites, Pre-established MOUs, Memoranda of Understanding, can streamline this process and clarify who is responsible for what. Decision-making under stress. Emergencies place jail leaders under intense pressure, often with limited time, partial information, and life or death consequences. 1. Maintaining security versus immediate evacuation. Jail staff must constantly weigh, is it safer to move inmates or keep them secured in place? Or does the risk of escape outweigh the risk of fire, flooding, or collapse? Example: a fire in an adjacent building may require moving inmates quickly, but only if doing so doesn't compromise control or expose staff to greater danger. Evacuation decisions should follow pre-written protocols, but allow discretion based on evolving conditions. 2. Use of discretionary authority and documentation. Line supervisors may need to act outside of normal SOPs, standard operating procedures, to preserve life or maintain control. Example: skipping formal count procedures if a tornado is imminent and inmates must be moved. Discretion must always be reasonable and based on safety, not convenience or panic. After-action reports must document the decision, the reasoning, and the outcomes. Decisions that deviate from policy must be justified clearly and reviewed during post-incident debriefs. Best practices under stress. Use checklists and ICS role guides to support decision-making. Delegate to trained staff to reduce cognitive overload. Conduct mental rehearsals and scenario-based drills in advance to build confidence. Clear, organized communication and calm, confident decision-making are the cornerstones of effective jail emergency response, when every second counts, relying on practiced procedures, chain of command. And team coordination ensures safety, preserves order, and reduces liability. Preparing staff in advance builds the confidence needed to lead when it matters most.